picture, I would say there's major cause for clinical concern, saying this is major neurocognitive disorder.
What would be interesting, of course, is if we had a spinoff and we had a movie or perhaps even a short on Trusty to see this social support that he has, because he's got tremendous social support. I mean, these canines are very friendly, typical dogs. I mean, so in that context, perhaps not, but I would love to see a spinoff. I would like to see some of the day-to-day things that Trusty has to do. Because he does seem to be struggling with I shouldn't say that, with significant memory deficits. One of the things that we've noticed, the field of psychiatry has observed with regard to this condition, formerly known as dementia, similar to a psychotic disorder like schizophrenia, is that individuals, and this was actually the way it was stated in a grand rounds I once attended, can't appreciate time travel. That is, they lose the concept with regard to time travel. And that becomes demonstrative, and clinically relevant when we try to take a patient history and you may ask a question with regard to the history of present illness, and you're told something with regard to the past psychiatric history, something that happened years, if not decades ago. So that difficulty establishing timeframes becomes, if not defining of, supportive of conditions like schizophrenia as well as major neurocognitive disorder. And we see that here. And we see that a lot of times with individuals struggling with this condition. So that is certainly going to be very high in the differential with regard to Trusty. Now, we did allude to this morning as well. If we think that there are cognitive deficits, what must the clinician consider? And there's two things now that really should come to the forefront of one's differential diagnosis. So delirium. We want to make sure that what we're seeing is not due to the direct and physiologic effects of a substance or another medical condition, because we would want to reverse that. We want to treat the underlying medical condition, and hopefully the cognitive deficits will resolve. And even if it is delirium, they're not going to resolve spontaneously. Right? It may take weeks, sometimes even months to come back. It all depends on age and level of medical comorbidity. Right? The other thing that we did mention is that there is a middle ground to this called a reversible dementia. That is, the individual actually has cognitive deficits absent disorientation and confusion, allowing for the diagnosis of major neurocognitive disorder, but the etiology is discovered and upon correction has the dementia process reversed. And then, of course, we have conditions in which that is not the case, conditions like Alzheimer's disease, major neurocognitive disorder of the Alzheimer's type, as well as vascular dementia, vascular etiology, that are not likely to reverse. And they don't reverse. They're irreversible, progressive neurological syndromes. There's one more one more mental disorder we have to consider here for Trusty. Yeah, major depression. We want to make sure this is not what was referred to as a pseudo-dementia. That is a major depressive disorder manifesting through cognitive decline. All right, so that would be, I think, the way to case formulate the retired bloodhound. Right, Trusty. Any other thoughts here?
The timeline for this film, first of all. They get a dog, a darling and a husband get a dog. 6 months later, they get the dog's license. And then by the next Christmas, there's a baby. I don't even know how old, but crawling at this point. This movie looked like it took place in a year. But how did she end up pregnant and have a baby in 6 months? Didn't make any sense there. But I wasn't sure if they got the dog either, to prepare for a future child, or for some reason maybe Darling couldn't get pregnant. But the way that they reacted when she was pregnant, it's a lady, almost seemed as though, at least at that time, that pregnancy was so risky that you couldn't do anything with the dog. Couldn't walk the dog, couldn't play with the dog. And the way way that Butch responded, once there's a baby, they're going to get rid of you, they're going to kick you out, you're going to be sleeping in the doghouse. I mean, this movie's pretty old. They even mentioned there's no way for us to know whether it's a boy or a girl. I'm like, really?
Mm-hmm.
When did this come out?
Mm-hmm.
So I'm not sure how, what health factors kind of sort of came into play with Darling, but sort of took it out on late, unfortunately. And I just thought the time was strange.
So kind of going off of that, I think the original it came out in the 50s, but I think it took place in like the 20s, something along those lines. So kind of going off of that, to me it seemed, I think I would argue it's probably a normal pregnancy, but just for that time, and even still now, but especially at that time, childbirth was so risky, and so medically hazardous for the mother. I can understand why the dad in that situation was acting the way he was, like, yeah, you can't take the dog for a walk, maybe being a little bit overprotective. And in doing so, I think the mom and the dad probably showed signs of neglect towards Lady, in terms of, they didn't seem to take care of her physical needs, and more importantly, her emotional needs, as a complex character rather than just a dog, at least.
The other thing I will add to this is that if in watching a movie things simply don't add up, especially from a medical perspective, the reality is that the writer-producer, perhaps and unfortunately so, didn't consult with, in this case, a psychiatrist before penning that script, before it going to production. That's the reality. However, we can kind of take an alternate reality and suggest that maybe that was in fact the writer's intent after all. And if so, when you're presenting something that's unrealistic, perhaps then the challenge, of course, is that we're seeing everything through the eyes of one of the characters who may be suffering from psychosis or delirium. Because in that context, it wouldn't add up, or at least it supports the idea that it may not add up, right? Because a lot of times individuals with psychosis may think that babies are born every other month, right? So in that context, maybe the film Lady and the Tramp is from a perspective of one of the characters. If so, it would be a character that probably has a psychotic process, putting us into the psychotic disorder versus delirium realm. And then the challenge is to discuss, who's the story being told through? Is there any other evidence in the film that might suggest it's one character versus the other? Right, so that's another consideration too. And we've done this plenty with a lot of movies, because a lot of movies, in terms of being factually based pertaining to the evidence-based literature, fall very short. And we can raise our hands and say that's because they just didn't consult a doctor when writing the script, but we could have some fun with it too. Right, so that's another consideration as well. Any other thoughts here with regard to Disney's Lady and the Tramp? What are some other etiologies of a major neurocognitive disorder other than Alzheimer type, vascular type?
Lewy body dementia.
Lewy body, right? So what's Lewy body dementia?
You have a buildup of alpha-synuclein and causes,
Yep.
And you get Parkinsonian symptoms like high-willing and tremor, all sorts of things that are similar to Parkinson's.
Due to the alpha-synuclein and the resulting neurocognitive deficits with Parkinsonian features, is there another element here that would be supportive of the diagnosis of Lewy body dementia? Visual hallucinations. All of a sudden, we could kind of tag team that with what I just said. Maybe visual hallucinations are part of that perspective of one of the characters after all. And might there be somebody battling Lewy body dementia here? And now we begin looking for signs of Parkinsonism in one of the characters. Is there an abnormal shuffling gait? Right? Is there difficulty initiating movement? Tremor. I don't know the answer, but this is where medical students go back and rewatch the movie with that focus in mind to then determine, hey, this might be actually about Lewy body dementia after all. Are there etiologies?
Frontal temporal dementia.
frontotemporal dementia. Yep.
Yeah, so I think that one seemed more like a disinhibition is the right word, I think. So I think it comes on around like between the ages of 40 and 60 is when it typically starts to manifest. And you have you see patients making rash decisions. They kind of lose their sense of control. And I think the word that's used to describe it is so-and-so no longer has a filter when it comes to the things that they say and the things that they do.
Sure. Yep. The insult to the frontal lobe results in an abrupt personality change, which is usually the reason for the consult, which is usually the reason why the individual presents the clinical care, especially in a case vignette on a test. And when evaluating the individual for their behavioral change or personality change, which is abrupt, which of course personality change would not occur in the context of a personality disorder, right? It's much more slow and progressive in terms of personality. That's when the cognitive deficits are revealed. And taking the two together, you have a baseline major neurocognitive disorder with the frontal lobe implicated, right? If autopsy revealed inclusion bodies, single best diagnosis. No? Inclusion bodies, frontal lobe? Behavioral change with cognitive deficits?
Frontal temporal.
Of what etiology? Creutzfeldt Jakob, right? Inclusion bodies. Prion disease. All right. Any other etiologies? Right. Pellagra. Yep. Niacin deficiency. But B vitamins in general too. Other B vitamins as well. Right. Any diarrhea? You're thinking of niacin. All right. Treatment. Let's say we do think that Trusty has a major neurocognitive disorder. There's still controversy with regard to treating mild neurocognitive disorder with regard to its progression. So let's make it easy. Let's just say major neurocognitive disorder, hypothetically, for the purposes of our discussion, has been ruled in. Biopsychosocial treatment planning. Family must be at the forefront. By the way, it is much. You have to remind me. I did not watch this movie recently. You have to remind me in terms of who Trusty lives with, because the majority of individuals with this condition live with their loved ones. If the idea that they're in a nursing home and cared for 24-hour supervision is not true, which means that you must pay attention to caregiver burden. The incidence of depression and even suicide among caregivers is extremely high, and that must be part of your treatment plan. Right? So the biopsychosocial treatment plan has been implemented, and now the patient trustee or perhaps their social support inquires, are there any medications that can slow the progression of this illness?
So I think there's two classes that I'm aware of. I think their effectiveness is somewhat debated, but I think there's an NMDA agent, memantine or something along those lines.
Mm-hmm.
Yeah, and then there's acetylcholinesterase inhibitors.
Mm-hmm.
I forget the silver-mistigmine,
Yeah, good. Yeah, it's actually AGE, right? If you go by Aricept, it's actually AGE, okay, which are the acetylcholinesterase inhibitors, and memantine is the agent that works on the NMDA receptor and reduces glutamate, which is a neurotoxin at high levels, right? Allowing too much calcium into the cells, right? Calcium influx, resulting in cell death. Memantine, as well as Aricept, are FDA approved for moderate to severe dementia. The others, mild to moderate dementia. There's also a combination pill, memantine and Aricept as well, which probably has a brand name that I'm just blanking on right now, but there is a combination pill as well. All of these have been shown in double-blind and placebo-controlled trials to slow the rate of progression. There is no reversible component to these medications. Right? They carry their own side effect profile as well, and the discussion must be had with caregiver and patient with regard to the benefits of slowing the progression versus the risks, the side effects. Let's see, what else about, any of the questions about major neurocognitive disorder? So what's the actual definition? Could you give me we said memory, but generally speaking, what the DSM will focus on is that is cognitive decline in two identified domains, one being recall or memory. Okay, what are the other cognitive domains that the DSM actually lists with regard to ruling in for major neurocognitive disorder? Mm-hmm. Yep. So motor activity, or motor activity, and of course, a deficit in motor activity with full motor function, the full muscle function, right? There's no myositis that would otherwise account for it. What else? You need two or more, and one must be recall/memory. Communication. Naming objects. And finally, executive functioning. So nothing to do with Lady and the Tramp, but there is a Stephen King novel called Duma Key that is a wonderful novel to read if you have time to invest in a novel these days, about major neurocognitive disorder. Very quickly, just to make sure we learn the diagnostic criteria. What happens is that this particular novel has not yet been adapted to film, focuses on our protagonist, Edward Fremantle, who owns and operates his own construction business, and upon traumatic brain injury with a crane falling on him and skull fracture, is discharged from the hospital with significant cognitive deficits, rule in major neurocognitive disorder due to TBI, which is another subset, which is another potential etiology, an etiology that is covered quite well with regard to Stephen King's Duma Key. He retires to an isolated island in the Florida Keys called Duma Key. He is one of only two inhabitants on the island. The only other house to be on the island is owned by a Virginia Eastlake who has Alzheimer's dementia, right? Major neurocognitive disorder of the Alzheimer's type. One night, Edward, for lack of a better description, goes into a dissociative phase and begins painting. And he creates a remarkable piece of art, never having touched a paintbrush before in his life. So he wakes up to this with full dissociative amnesia. He knows he did it, but he has no idea how. The paintings become much more intricate. And what he recognizes is that if he doesn't discover the source to this, the origins of what's going on, it is going to kill him. So it's a form of possession. There's only one person that knows what's going on, and it happens to be Virginia Eastlake. Unfortunately, due to her advanced Alzheimer's, she has no memory or recollection of this. So this story becomes a narrative about two people on an isolated island who need each other in order to survive, both of whom have major neurocognitive disorder, albeit of different etiology. The crane accident is noteworthy here because crane becomes the acronym for your DSM diagnosis. Communication, recall, activity, naming objects, executive functioning. You need two total, one must be recall. All right? Anything other than trustee here?
I guess, and I don't know how strongly I feel about wanting to consider this diagnosis, but I guess it is something I kind of noticed with Lady specifically, that there may be some inklings of dependent personality disorder, in the sense that when she's initially like very dependent on her family, she likes having the attention around, and when they kind of cast her aside for the baby, and especially when the aunt comes around, one of her major coping mechanisms is finding someone else to attach to, being Tramp in that case, so I don't know if she meets, I don't think she really meets like much of the other criteria, but like that pattern is something, I think seen in independent personality disorders, so it's just something I think of.
So let's just take a little step back and just talk about the cluster C personality disorders, and as much as we're prepping for your test next week. Number one is a condition called the obsessive compulsive personality disorder. This is a misnomer. This is a condition that is much better titled or labeled the anal retentive personality disorder, or the type A personality disorder. Individuals with this condition show no evidence of obsessions. They show no evidence of compulsions, but they are everything perfectionist, control, that again personify the type A personality. Okay, that's OCPD. Avoidant personality. Individuals with this condition will avoid tasks or situations in which something is expected of them. Right? It's the avoidant personality. The individual with avoidant personality disorder lives by the creed that it is better never to have loved at all than to have loved and lost. If I can't put myself out there, I can't get hurt. And what happens is that they actually do avoid injury. So by avoiding the noxious stimulus of being turned down or being shunned or rejected, the behavior continues. The avoidant behavior continues, and that is called negative reinforcement. So if you're asked on a shelf exam, negative reinforcement is the behavioral paradigm, the type of learning that results in or perpetuates the condition of the avoidant personality, because they don't put themselves out there and they don't get hurt, therefore rewarding and reinforcing that avoidant behavior. Right? The removal of the noxious stimuli is the negative part of negative reinforcement. And then finally, the dependent personality disorder, the individual who requires validation and reassurance for their every next step. Right? This is the individual who is often a rebounder and has a very difficult time with regard to not being in a relationship, especially one that could guide them in terms of which direction to take, if not on a minute-to-minute basis, certainly on a day-to-day basis. So those are your three cluster C personality disorders, which do have some correlation with the anxiety disorders. Any other thoughts about Lady and the Tramp? Let's get back to Trusty in closing this. All right. There's one more aspect of Trusty that we didn't uncover that I think is significant with regard that it is in the script that as clinicians we can't miss. Yeah, we can't ignore this, right? Because there is a cause etiology of both anosmia, right, the syndrome of the sensory loss of smell, the loss of the sense of smell, and dementia, right? And that is zinc toxicity, right? So, in looking close at this, we have to wonder whether or not there's that third variable, that common etiology, that might explain why he lost his sense of smell, zinc toxicity, as well as why he may be demonstrating cognitive deficits. And does anybody know the number one etiology of zinc toxicity in dogs? I had to look this up because I'm not a doggy psychiatrist. It's actually the ingestion of pennies. Okay, which is why on yesterday's Instagram we saw that picture of Penny and Bolt, right? Penny and her dog. So don't ever let that allow that never to have you forget that zinc toxicity is a common etiology. You're probably, well, if you're a psychiatrist in the future, you're probably not going to see much anosmia unless you practice geriatric psychiatry and you see that in your elderly population. But you're definitely going to see some form of cognitive deficit, right? Whether it's in the form of a psychotic disorder like schizophrenia, dementia praecox, or major neurocognitive disorder, formerly known as dementia. Right? So, zinc toxicity. The only other thing I wanted to mention here, since I had planned to discuss this more next week until I realized that my clerks will be in exam, right? This is your last day, so I make sure. Is that there's another heavy metal exposure that we probably should discuss because heavy metals do come up on exams. And it's probably worthwhile to understand some of these exposures. And there's one I just want to touch on now. We can certainly touch on others this afternoon during rounds. But there's one that is captured through The Little Mermaid. Right. So has anybody here ever seen The Little Mermaid or have seen it in the past? So we get a lot of nods. So from this perspective, tell me what you remember about Ariel. If someone here had never seen The Little Mermaid and they asked you to describe Ariel, what did they need to know to understand this character?
She's a really curious young girl. She's like kind of rebellious in the sense that she doesn't want to do what her father wants her to do. She always goes out, like, she goes to the ship, like, look for stuff, she always finds, like, kind of like a fork, like, she finds these unique little things that she's never seen before. She's really intrigued by them.
Mm-hmm.
And she's really curious and goes out and wants to adventure, wants to see, like, the rest of the world.
So, I'm gonna just paraphrase. So she's a rebellious teen. I think more specifically, a rebellious teenage mermaid, right? Let's not lose sight of that. For those who haven't seen The Little Mermaid, it is about a mermaid who lives under the sea and longs to live on land, especially after, she's been basically spying, right? She's been eyeing what it must feel like to be human. What else? She get her wish. Okay. What happens when she gets her wish? How does she get her wish? All right. So she makes a deal with Ursula. What's the deal? Right. So she trades for legs. Describe to me when she gets her legs. Recapture that scene for us.
Maybe the cancel being born because she falls around something. She's not used to it.
Right.
It's like beautiful.
Mm-hmm. Yep. What's interesting is that it's reasonable, but if you read the original story, that too. Spoiler alert. The reason why she has ataxia is that her feet are described as being stabbed by 100 knives. Right. So, in a clinical context, what would a physician describe that as? What's the clinical term you've likely used? Yeah. She's neuropathic. She has neuropathy. Okay. And then, what's the other part of the deal here? Right. Right. And we know how that ends in the real story. And so she goes up to the prince. She talks to the prince. They hit it off, and she's saved. Right.
Almost, but she can't talk.
That's the other part that we have to make sure that we remember is that she has aphonia. Right, as part of the deal, she can't talk. So somebody presents to you. Let's say we have a consult to see next, and we have someone who presents with new onset aphonia, admitted to the hospital, and because of the H&P revealing that she believes she is a mermaid who lives under the sea, psychiatry is called. Okay, and upon our clinical exam, including a neurologic exam, she does endorse, perhaps in a review of systems, severe neuropathy, lower extremities bilaterally. So we're given that triad: aphonia, neuropathy, and psychosis. What heavy metal? Mercury poisoning. Good job. Yep. Mercury poisoning, which, by the way, how is mercury poison? After we discovered that we can no longer line hats with mercury, causing the Mad Hatter syndrome, delirium brought upon by mercury poisoning or toxicity, what is now the most common way humans succumb to mercury poisoning? Yeah, right. So, and that's a mermaid, right? So, Little Mermaid reminds us of the triad of mercury poisoning, which again, as soon as we see this triad, someone who presents with psychotic, get psychiatry over here, rule out schizophrenia, we see severe neuropathy and aphonia. We're going to ask about the consumption of fish. So I just want to make sure I covered that as well. There are other Disney films that support toxin exposure as well, but we'll stop here with regard to our broadcast, and we could pick up and discuss when we have time later on this afternoon about those.